Hello, everyone, and thank you for joining us today to discuss the importance of emotional safety in the rollout and implementation of the vaccination of children against COVID-19. I'm Bailey Kasten, Chief Operating Officer and Interim CEO for the Association of Child Life Professionals, representing our almost 6,000 members, including child life specialists and our healthcare allies. Our certified child life specialists live and work in over 82 countries worldwide and practice in upwards of 600 child life programs in North America. The Association of Child Life Professionals has created the Emotional Safety Initiative to engage all our multidisciplinary and nonprofit partners to bring focus and awareness for healthcare administrators and parents and caregivers on the importance of building in a framework of emotional safety to protect children during medical and other stressful procedures. It is with that lens that we are gathered here today to discuss emotional safety and vaccine implementation, and I'm excited to introduce our first speakers. For those reporters in attendance, I'd like you to know that we will have a Q&A session after the remarks, so you can enter any questions in the chat box as we go through. First, I'd like to introduce Kim Stevens, President of the Association of Child Life Professionals and Director of Child Life and Expressive Therapies at Dell Children's Medical Center in Austin, Texas.
Thank you, Bailey, for that introduction, and thank you all for attending. As Bailey said, I'm the Director of Child Life and Expressive Therapies at Dell Children's in Austin, and I am a certified child life specialist, currently serving as the president for the board of the Association of Child Life Professionals. Certified child life specialists are trained professionals who are educated and clinically trained in the developmental impact of illness and injury. We work in both healthcare and community settings and help infants, children, youth, and families cope with the stress and uncertainty of acute and chronic illness, injury, trauma, disability, loss, and bereavement. Child life specialists provide evidence-based, developmentally and psychologically appropriate interventions that can include therapeutic play, preparation for procedures, and education to reduce the fear, anxiety, and pain, and to promote emotionally safe care. Providing emotionally safe medical care is critically important as it can have a lasting impact on the future coping and engagement with healthcare. When it's not provided, the impact can lead to traumatic stress, avoidance of preventive healthcare, and poorer health outcomes. A close family member of mine had a diagnosis of osteomyelitis as a child in the 1940s. The child life profession had not yet evolved, and emotionally supportive care was not a concept. This family member endured 7 surgeries, a year-long hospitalization, and permanent physical changes to her appearance and her abilities. She remembered being held down by staff to have blood tests and having an anesthesia mask held over her face without any support or explanation of what was happening or why, and without the presence of her parents. If she had been hospitalized today at Dell Children's Medical Center or any other healthcare facility with a child life professional on staff, a child life specialist could have helped her by using medical play with dolls and medical equipment to assess how much she understood about her bone infection and given her the opportunity to process and express her feelings about this experience. They could have prepared her for blood tests and her surgeries by talking to her about what she would see or hear or feel, practice with an anesthesia mask to see what it would feel like and smell like, and create a coping plan to help her through the experience. They could have educated her about her diagnosis and the subsequent physical changes post-surgery that she would have for the rest of her life, using developmentally appropriate teaching tools, books, dolls, and helped create a transition plan to go back to home and school. Because this family member did not receive these type of interventions, she subsequently suffered from pediatric medical traumatic stress that negatively impacted her daily functioning, her ability to adhere to medical treatment, led to a reduced quality of life, and subsequently led to her death from a treatable medical condition. Because children process information from the world around them so much differently than adults, they have very distinct needs for managing the effects of stress and trauma. This has become especially important to recognize as we continue to navigate through the challenges of the past year in this pandemic. Discussions of coronavirus, mask wearing, vaccination can be scary to all ages, but especially to children and adolescents. We must be prepared to educate caregivers and emotionally support families as they continue to support their children through these experiences. Child life specialists are the emotional first responders who can help support these needs. ACLP is committed to supporting the adoption of emotional safety as a key principle for all healthcare encounters to create positive and emotionally safe experiences and improve health outcomes for all. So thank you for giving me the opportunity to speak with you today.
Thank you for sharing, Kim. Next, I'd like to welcome Jenaya Gordon, who is manager of the Child Life Department at Children's Hospital Colorado in Aurora, Colorado.
Thank you, Bailey. The ethical responsibility to first do no harm extends beyond the body and into the minds of those seeking care. Our goal is to promote the inclusion of emotional safety into the physical safety programs and initiatives, as they're two sides of the same coin. So wherever we're discussing how to keep our patients physically safe, we should also be discussing how to keep them emotionally safe. This emotional safety initiative and the subsequent paper written are designed to guide organizations and individual healthcare professionals in incorporating pediatric patients and families' emotional, developmental, and psychosocial needs when providing their medical care. The clinical components include providing atraumatic care, which is avoiding causing medical trauma, developmentally appropriate care, which is creating individualized plans based on the developmental and sensory needs of our patients. Trauma-informed care is supporting trauma responses and planning for and avoiding creating new trauma reminders. Culture-centered care, which includes families' cultural needs and perspectives at every level of care offered. And family-centered care, which considers the family support system needs and inputs at all levels of care. Those clinical components are the foundation of what the profession of child life is based on. And looking through those clinical components, we've created 4 pillars of emotional safety in which the components are infused throughout each pillar. The first pillar in our emotional safety initiative is assessment and screening. And that is creating a plan to proactively examine the patient and family's needs through the lens of each of those clinical components, and then creating the plan subsequent based on that information provided. Interventions explore specific actions that healthcare professionals can take to ensure the patient's pain, understanding, and fear are addressed and supported. The environmental pillar creates a physical and cultural environment which supports the emotional safety of patients and families. And the education and training pillar discusses tactics to train all healthcare professionals and staff in how to communicate with and support pediatric families based on their unique needs. The findings of our research in the paper really speak similarly to what Kim shared with her story, that unfortunately that story is not unique to pediatric patients across the country and across the world. The National Child Traumatic Stress Network reports that up to 80% of children and their families experience some form of traumatic stress following medical treatment for life-threatening illness or injuries. That includes not just the patient themselves, but also their caregivers and their siblings are experiencing traumatic stress from the care that's designed to help support them. Needle fear and phobia are often a result of frightening, painful needle-related procedures in childhood and persist throughout people's lives. The impact of pediatric medical traumatic stress that extends into adulthood, as Kim said, can really impact their physical health. And this is why the emotional safety movement needs to be tied to physical safety, because they do overlap and impact one another. Injection phobia can lead to medication refusal, avoidance of preventative health, foregoing vaccinations, and delayed medical care in adulthood, negatively impacting the health-related quality of life. Conversely, managing pain and providing developmentally appropriate and emotionally sensitive care in pediatrics paves the way for positive future health encounters. Thank you for joining us today.
Thank you, Jenaya. I appreciate it. I want to next introduce Stacey Koenig, Senior Director of Patient and Family Services at Children's Mercy Kansas City in Kansas City, Missouri. Thank you.
Thank you, Bailey. I wanted to share today how Children's Mercy is supporting families in vaccine clinics. So our Child Life Department was included as an essential member of the initial planning of the vaccine clinics here at Children's Mercy in Kansas City. And in the state of Missouri, patients ages 12 to 22 who fit within the medical complexity category as specified and or who had intellectual disabilities were vaccinated first. So to prepare for that population, our Child Life specialists worked with staff planning and managing the vaccine clinic to establish supportive systems for all of our patients. We established a room that is known as the quiet zone, where patients and parents could receive their vaccine one-on-one with a nurse if the noise of other patients and staffing the room was too difficult for the patient to tolerate. We also established that lighting in the vaccine room could be dimmed, yet still bright enough for nurses and staff to effectively administer their vaccines. A relaxation app is utilized on a large screen in the vaccine room with a variety of calming nature scenes and sounds. We also had a vaccine clinic during the KC Royals Day home opener. And on this day, we had the baseball game on in the room if patients were interested in the game. And we provided Kansas City Royal themed activities for patients while they waited in the observation area after the vaccine. Our Child Life specialists meet all patients and families right after the registration to assess the child's coping with vaccines in general and to assess any other identified needs. After the initial assessment, Child Life specialists form a quick coping plan with each patient and family that includes a choice of distraction materials like an iPad, a book, light spinners. We give choices of positioning, like do they want to sit close to their mom or or on their caregiver's lap, or do they want to sit independently? At Children's Mercy, we chose to use pain ease spray and a shot blocker, and Child Life specialists would explain these two items and offer to the patient. Child Life specialists accompany the patient and family into the room and provide procedural support if the patient desires that type of support. After the vaccine has been given, it's very important to celebrate. So patients are invited to take a selfie photo with the I am vaccinated sign, and Child Life specialists offer stress balls, Play-Doh, and other small distraction toy items as a way to celebrate their accomplishment. We also remind the patients to bring those items back for their second dose. Handouts were also created to help patients and families prepare for the second dose clinic, including a handout about lidocaine 4% that can be purchased over the counter and applied prior to coming back for their second dose. So with all of those, in an after vaccine survey, we had a patient share. I was super scared of needles, and this really helped me a lot. First time I didn't cry getting a shot. Another child stated, I came into the clinic crying, but I left smiling. Also, a parent commented, these things were really helpful to reduce my daughter's anxiety. This was great because she usually is nervous about needles and shots. These things will make coming back for our next shot a lot easier. So overall, we wanted to make the vaccine clinic as positive as possible for patients, and we also wanted to celebrate their accomplishments, their bravery, and help them reframe the past negative vaccine needle experiences they may have had. So thank you for having me here today.
Fantastic examples, thank you. Now I'd like to introduce Michele Hall-Duncan, President and CEO of Encourage Kids.
Hello, everyone. I am so excited to be here, and thank you, Bailey, for that introduction. Listening to everyone talk about how a child life is essential to intervene and help children when they are being vaccinated and in all types of medical situations is very familiar to me. As president and CEO of Encourage Kids Foundation, we have partnered and supported Child Life for over 35 years. We recognized very early on that any programming that we wanted to deliver here at the foundation needed to have the support, not after it was formulated, but right in the building phases, because Child Life is extremely knowledgeable. They understand how to provide emotional safety for children. They do it every day, and they are on the front lines constantly. So much of the programming that Encourage Kids has been able to deliver over the past 3 decades has been fully vetted and sanctioned by the Child Life community. One of the other ways that we have proven our support to child life and our love of child life is when you look back over, the past decades, as one of the other panelists said, child life was not available. I myself had an experience as a child that was really daunting, and it sticks with me today. And I think that's how you know that you had a traumatic situation, when you keep talking about it and you can remember vividly what happened to you. I would have welcomed having a child life specialist when I had a spinal tap and was terrified. And the nurse told me if I wouldn't be still, I would be paralyzed. Again, as a 50-something-year-old woman, I remember that trauma. And had I been treated by one of the wonderful panelists here today, I'm sure I would have had a much more positive experience. As we look at the time that we're in right now, and the crucial situation of having to have kids and teens vaccinated in response to the pandemic and getting ourselves through the pandemic, it is essential to have child life present. As you just heard from Stacey, those interventions were absolutely incredible. And the positive outcomes that the children received, feeling like they had accomplished something, mitigating those fears, mitigating the pain, is very, very important. And I have to tell you, I'm sure that child life specialists all across the country have helped to provide emotional safety through thousands and thousands of needle sticks. And it's one of the things, oddly enough, that kids and adults are most worried about: IV starts, shots, vaccinations, and everything else. So at Encourage Kids Foundation, we believe that child life needs to be present as we expand our vaccine efforts to our kids and our teens. Thank you for listening today.
Thank you, Michele. And finally, I'd like to introduce Dr. Jen Jewell, pediatric hospitalist at the Barbara Bush Children's Hospital at Maine Medical Center and board member of the American Academy of Pediatrics Maine chapter.
Thank you, Bailey. We can all agree these past 13 months have been an unprecedented time that has affected children in unimaginable ways. As we return to our pre-pandemic routines, infants, children, and adolescents need to catch up on their preventative healthcare visits, including vaccines. Additionally, we should prepare for the near future when school-age children may be eligible for COVID vaccines as soon as the autumn of 2021 or the winter of 2022. The Association of Child Life Professionals is a leader in emotional safety, an intentional interdisciplinary practice to promote resiliency, healing, and trust for pediatric patients and their families during medical experiences. As a pediatrician, I know that emotional safety is paramount in reducing long-term stress, trauma, and fear that accompany medical care, including vaccines. Without emotional safety, individuals experience long-standing emotional scars that may result in avoiding preventative care, delaying urgent medical care, and refusing vaccines. Part of emotional safety is appreciating caregivers' intimate awareness of their children's physical and emotional states. Even when child life specialists are not immediately available, caregivers and medical personnel who administer vaccines can positively influence emotional safety in the following 5 ways. Number 1, provide children with pre-vaccine information using age and developmentally appropriate, honest language prior to attending appointments so that there are no surprises. 2, acknowledge that caregivers know their children best. 3, give children reasonable choices, like what they would like to do on the way to or from their vaccine appointment, and in which arm they would like to receive their vaccine. 4, use comfort measures during vaccine administration. The most popular is a comfort hold with children upright in a caregiver's lap or chest to chest, like a hug. 5, utilize distraction for children during their vaccine, including telling stories, snuggling a blanket or other object, reading a book, singing songs, or even listening to music. Addressing emotional safety promotes resiliency and engenders trust. Then, future medical care is less likely to be associated with fear, anxiety, and poor coping skills, and is more likely to be a positive experience for children and their families. The Association of Child Life Professionals, the Barbara Bush Children's Hospital, and the Maine chapter of the American Academy of Pediatrics encourage caregivers and medical providers to prioritize emotional safety and recommends that children receive all of their vaccines unless there is a proven medical reason to avoid them. Thanks, Bailey.
I want to thank all our speakers for sharing all your perspectives and your information on this topic. I'd like to now introduce the Q&A section of the call. If you're interested in submitting a question, please do so through the Q&A box and share your name and media organization if you can. So we have a couple of questions, so I'm going to get started. The first question is from Nick Woodward, and the question is, what prompted this today? I mean, isn't getting your shots just a normal rite of passage for most kids? Measles, mumps, rubella, varicella, tetanus, etc. What's different about this to cause you to call for more care and caution when it comes to trauma? I think, Kim, I'd like you to answer this question as to why we're focusing on with the Emotional Safety Initiative now.
Sure, thank you. I think one of the things we've seen as this pandemic has continued is just such an increase in the amount of mental health stress for children and adolescents. I know in our hospital settings, the number of children being hospitalized with mental health components is dramatically increased. So, part of the reason for the why now is to combat some of that, but also because of the research that's been done and that Jenaya shared in emotional safety work around just knowing the impact of needle phobia. I think you're right. It was often considered sort of this rite of passage and like something that you had to learn how to get over. But we now have the knowledge to know that that really impacts the long-term ability of people to continue to receive medical care. Needle phobia is a real thing with true impact. So I think that's part of the impetus for why now. I mean, this emotional safety work began before the pandemic because that research was there and we knew it was really important. But it's even more important now, knowing what we know about how children are responding and adolescents are responding to the stress.
Absolutely, thank you. Okay, I have another question. And is it too late to bring child life specialists into the decision-making process for vaccines? And at what level should they be involved? Stacey, can you answer that question since you're doing this now?
Sure, that's a great question. It's never too late to involve the child life profession into things like this. We are quick on our feet. We're problem solvers. I would say that, involving them in the initial process is the best because you're going to have the best laid out plans for patients and families. But if you are holding a clinic today and you know that you could reach out to a child life specialist, they will show up. They pivot very well. They come equipped and they know how to develop trust really fast with our pediatric patients and their families. It's just a perfect profession to bring in at any time during the process. But initially, I would encourage healthcare providers that are having vaccine clinics to lean in to hospitals and find out about the resources they have in child life and how we can help.
Can I add one thing, Bailey? That, even if you've already been having your clinics and they're done, it is not too late then too. Like there are resources that could be provided that can help you do follow-up with those families to try to mitigate anything that was traumatic about the experience and make plans for the future so that it's not, preventing them from seeking further care.
Great, thank you. And just a reminder, if you'd like to ask a question, you can go ahead and use the Q&A box and as part of the Zoom controls. Okay, so I have another question. If there isn't a child life specialist available, what are steps that parents can take to set their kids up for an emotionally safe experience while waiting in line or as their child is getting the vaccine? Actually, Jenaya, I think that might be a good question for you to answer, being so familiar with our framework.
Sure. Like Dr. Jewell said, there's specific steps you can take as far as preparing the child prior to coming in for the appointment. And on our emotional safety website, we have some of those resources and handouts to give to parents as far as language to use that's developmentally appropriate and soft so that kids know what to expect and are getting that information in a way that isn't overwhelming or frightening to them. And then also resources based on what you can do to support your child during the procedure. So as Dr. Jewell said, using supportive positioning where the parent's comforting the child, but also holding them still, using distractions. So maybe bringing a special book or an app that they don't normally get to play with and making it something special that they can do in those moments of while they're waiting and also while they're getting the injection can help as well. Another piece that parents can do and caregivers can do proactively is if you are worried about your child or even adults who may have developmental disabilities or sensory sensitivities, is speaking to their primary care physician, because there might be something that they can do to help regarding medication for anxiety, or as I believe Stacey mentioned, having some of the topical anesthetic ready to go and in place when they come in, so that we know that we're supporting their pain and their fear and we're giving them information in the best way possible. But there's some really good resources on the emotional safety website that can help with that. Thank you for the question.
That's emotional-safety.org is the web address for emotional safety, and there are a lot of great resources to share there. Well, I think that's the end of the questions that we've got in. Unless there's anything else, I think we can go ahead and close, but I want to thank everyone for attending, for giving time and attention to this really important issue in protecting emotional safety of children. Thank you for our panelists. We appreciate your sharing your insights and perspectives. If there are any reporters who would like an interview after this as a follow-up, you can reach out to Michele Blundell with MNR at mblundell@mrss.com. Maybe somebody can chat it in there. But we're open for interview and follow-up as well. So thank you so much for attending and for everyone's time. I hope you have a great day.